My name is Jonathan Rohrer. I'm a lecturer. I work at the Dementia Research Centre, which is in the UCL Institute of Neurology, and my main area of research is dementia, and more specifically I work in a type of dementia called frontotemporal dementia. That's often a young onset dementia, so people tend to develop symptoms in their 40s or 50s, and at that age it's about as common as Alzheimer's disease. We've been working with people who have a genetic form of frontotemporal dementia. So because they have a genetic form, they have what's called an autosomal dominant disease. Now what that means is that the disease passes from one generation to the next, and there's a 50% or 1 in 2 risk that a parent is going to pass that on to a child. So much of the research that we do is actually with children of people who have the disease. Those children know that they have a 50% risk of developing it, and we know that we can work out whether they carry that gene or not. So we tend to follow people from quite a young age, from their 20s or 30s through to their 50s and 60s when they may develop the disease. So because we have people at a variety of ages through their 20s, 30s and 40s who are 5, 10, 15, 20, 30 years before they might develop symptoms, we can have a look what's happening in their brain using brain imaging at all those different time points before people develop symptoms. So what we've shown so far is that with a particular form of brain imaging, with structural brain imaging, we can see abnormalities in very specific bits of the brain up to 10 years before people are likely to have developed symptoms. What we're now doing is looking at more detailed types of imaging called diffusion tensor imaging, resting state functional MRI. These are more detailed types of imaging to see if we can push that further back. We suspect that we'll be able to find problems 15, 20 years before, but we're not sure of the answer to that. That's what we're working on at the moment. So we know with one type we can get back to around 5 or 10 years before, but we suspect that we can get even further back. So dementia is a hugely important disease in society. It's increasing in frequency. There are going to be 1 million people in the UK with dementia by 2020. And so it's a huge public health burden, and what we're trying to do is to work out how we can try and treat different forms of dementia. So in frontotemporal dementia, and actually in other types of dementia, the work that we do here is trying to work out, firstly, when does the disease start? So we know from some of the research we've done already that if we look at brain scans of people with dementia, we know that if we scan them before symptoms start, that actually we can see abnormalities on their imaging around 5 or 10 years even before they develop symptoms. That suggests that there are problems in the brain happening well before people develop symptoms. So we know that if we can see these problems, that's probably the right time to actually treat people. It may well be that by the time people develop symptoms, it's actually too late to actually treat people. So we're working out what's the best imaging method to try and see how far back we can see abnormalities. Are we going to be able to see problems 10 years, 15 years, 20 years before people develop symptoms? Is that going to be the right time to actually treat people? We don't know the answer to that question yet. We've got some ideas about when we should be treating people, but we don't know how far back we can push it. The other important thing is, if we do develop a drug that works in people with dementia, how do we know that that drug's actually working. So we want to be able to know that if we give a drug at time point 1, what's happened at time point 2? Has that drug worked or not? And we think that brain imaging is a good way to be able to do that. If we can show that there's been a decrease or even a stop in the number of brain cells being lost that we can see on brain imaging, then we know that that drug is working. So the two key things really from the research are, can we actually track disease? Can we actually monitor disease progression? And can we actually say when the disease starts? So can we say when the best time to actually give a drug actually is?